So my talk today was about the state of health of research in the UK. And I think it's a very healthy place. Not necessarily for commercial studies, but our academic studies are really top line, and we are and have made huge difference in terms of the outcomes that we've described from our trials. I think the most important thing is it's a very collaborative effort. We've got a great team. So included in that would be the trials team at Leeds, the genetics team at the Marsden, the immunology team at Birmingham. But I think most of all, we have fantastic researchers who around the country contribute lots of patients to the studies. So I think we are in a healthy place. And now we have radar and we're looking to a future elderly study. I think those studies will continue to be very important.